So we are honored and so fortunate to close out this Impact Forum with a phenomenal keynote speaker. I had the chance to meet Bob McDonald this fall when he was here at Lake Nona, and was inspired by his words and by his passion, and left there feeling like the Veterans Administration couldn't be in better hands. So to introduce Bob, I'm going to ask Sesh Thacker to come up and say a few words.
You know, Secretary McDonald is a graduate of the United States Military Academy at West Point and an alumnus of the University of Utah, where he got his MBA. An Army veteran and both Airborne and Ranger qualified, he served with the 82nd Airborne Division. Upon leaving military service, Captain McDonald was awarded the Meritorious Service Medal. In 1980, Secretary McDonald joined Procter & Gamble, a Fortune 50 company, a name that we all know, and he rose through the ranks to become its CEO and president, and he retired from Procter & Gamble in 2013. After being nominated by President Obama as the 8th Secretary of Veterans Affairs, he was confirmed by the U.S. Senate in July of this past year. We are blessed that Bob has chosen to make Orlando his home, so the community here will get to know him better. I love his energy, his spirit, his humbleness, and his passion for wanting to make a difference in the world, but more importantly, specifically for this nation's veterans who deserve the absolute best. Ladies and gentlemen, it's an honor to introduce Secretary of Veterans Affairs, Bob McDonald.
Thank you, sir. Thank you so much. So as Paul Harvey said, let me tell you the rest of that story. Actually, it's true. I retired from the Procter & Gamble company, and my wife and I were both looking for another place to live. And so we looked all over the country, and my wife and I both have grandchildren. I mean, we have grandchildren, and we said, you know what, Orlando looks like a really great place. And so she was looking at houses, and I was looking for development. I had participated on the Singapore Economic Advisory Board, the International Advisory Committee there. I had been involved in A-Star and Biopolis, which is the medical hub in Singapore. And I was always wondering, why does the United States not do as good a job as some countries like Singapore in bringing together companies, nonprofit, for-profit, to create innovative locations like we have here in Lake Nona. So the truth is, we bought a home in Alworth nearby, and one of the reasons we did that was so we could spend time here in Orlando, take advantage of the Lake Nona connection, and be part of this community. That was before the president called. I live in Washington, D.C. now, and but we still have that home in Alworth, and we're looking forward to moving in. We'll be neighbors of Sesh's. But I'm thrilled to be here, and I congratulate Thad and Sesh and everyone on what you're doing here, because I think this is critically important to our country, critically important to Florida, critically important to the community. I've titled my talk, Caring for Veterans, a Higher Calling, and I want to take you through what's going on at the VA. The reason when President Obama called, I said immediately that I wanted to do this task is my life, my history, has been all about caring for others and improving lives. Believe it or not, these 5 pictures are of the same person. On the far left, you got this geeky looking kid named Bobby. When I was young, I was a Boy Scout, I was a Cub Scout. I really loved the idea of helping other people, and I knew that I got a great deal of satisfaction doing that. So when I was in 6th grade, I was 11 years old, I first applied to go to West Point. At that time, there were people living behind the Iron Curtain, there were people living in communist countries, and I thought by being an officer in the Army, I could help free those people, and that's what encouraged me to go to West Point. And you can see, if any of you have studied ancient history, you can see I got my diploma from President Ford. Then after I graduated, I went in the 82nd Airborne Division. I could have gone in any unit in the Army, but I wanted to be on the tip of the spear. In those days, the 82nd Airborne Division was the rapid deployment force of the Army. Parachutes were always ready to go, and served in the infantry, and as Sesh said, was an Airborne Ranger. And then when it was time to get out of the Army and finish the MBA, I was looking for a company that had a purpose similar to my own of improving lives. And that's what led me to the Procter & Gamble company. And that's the black and white photo here. That's my first day at Procter & Gamble, June 4th, 1980. What was exciting about the company, and what is still exciting about the company, is on any given day, today, for example, there will be over 5 billion people on this planet use at least one Procter & Gamble product, and those people will tell you that that product improves their lives. Now, one of the things you can tell, a shortcoming of the company, if you look at that photo and you look at me today, is we have not figured out hair loss. But there is hope. We are working on it, and I hope it comes soon. And so when the president called me and asked me if I would be interested in trying to turn around the VA, I immediately said yes, and I've been thrilled to be there. The VA really got its inspiration from the Civil War. It was in President Lincoln's second inaugural address where President Lincoln said, "We need to care for him who had borne the battle, his widows, and his orphans." The Civil War was devastating for this country, beyond what we think of today. Do you realize 750,000 Americans died in the Civil War? That's 514 a day, 514 a day, every day, for 4 years. That's an enormous, enormous carnage. And the country wasn't ready for that carnage. In fact, during what happened in the Civil War, as casualties would occur, the people were literally buried in mass graves on the battlefield. There wasn't yet an ethos of sending letters to loved ones about what happened on the battlefield. There were no dog tags. When I was in the Army, you always wore a dog tag on your collar and usually put one in one of your bootlaces in case your legs got separated from your body. But in those days, they were all buried in mass graves. And in fact, recently I was at the Harvard Law School recruiting lawyers to work at the VA. And they have there the tag that Oliver Wendell Holmes, a Supreme Court justice who fought in the Civil War, pinned on his blouse as he went in the battle of the Civil War. And it basically said, "If something happens to me, send my body to this address." Well, President Lincoln, in his second inaugural address and going forward, worked with the Congress to establish geographies around the country that would become our national cemeteries. And today, the forerunner of the VA, we operate national cemeteries around the country. We dug up the bodies off of the Civil War battlefields. We were able to identify about 65% of those men and women who died in those battles and rebury them in national cemeteries. We paraphrase President Lincoln today. We don't use just the male gender. We actually say it's for those who have borne the battle, because today 11.5% of our veterans are women. And beyond that, soon 20% will be women, because DOD has a higher percentage of women, Department of Defense has a higher percentage of women than we do as veterans. This is a really significant issue for us, because caring for veterans, we've got to care for those women. So we need more space. Many of our buildings are old and were designed before we had to deal with multiple genders of veterans. And so we need more space. We need to set up women's clinics. We're in the process of doing that in many of our geographies. We just opened a new one in Washington, D.C. We have one down in Atlanta, Georgia, in the old land of Fort McPherson. And so we need to hire gynecologists. So this is a big change for us in the VA. We now have 359,000 women serving in the Department of Defense. So this is huge, and is going to be part of our change going forward. Our values are integrity, commitment, advocacy, respect, and excellence. One of the first things I did coming in as secretary was to ask everyone to recommit themselves to our mission and to our values. We do this every year now as an annual ongoing exercise to make sure that these things guide our behaviors going forward. We have 9 lines of business, but we're really organized into 3 administrations. The first is our Veterans Health Administration, which is over 2/3 of the VA in terms of number of people. The Veterans Benefits Administration, where we pay out benefits to veterans. And then the National Cemeteries Administration, which is really the forerunner that I talked about coming out of the Civil War. While healthcare is such a big part of us, I want to let you know about our other lines of business. They include such things as life insurance. We're one of the largest life insurance entities in the country. Mortgage insurance, pensions, disability compensation, memorial affairs, and importantly, education, that famous GI Bill. The GI Bill hit its 70th anniversary last year, and we know that the post-9/11 GI Bill is key to providing economic opportunity for veterans. Our Veterans Economic Benefits Report found that the post-9/11 era veterans are doing better than their peers in earnings, and female veterans are doing well in both career earnings and education compared to their peers. So we know that military service and the veterans' benefits that they get afterwards do make a difference, a significant difference in the lives of these people. But half of all separating post-9/11 veterans face a period of some unemployment, and we're working hard to make sure that that doesn't occur. We have to keep doing better in creating a seamless transition between the Department of Defense and the Veterans Affairs Department in order that we care for our veterans as soon as they get out of the military. Also, we've got reasons to be proud of some of the advances we made in some other areas. We've cut our disability claims backlog by 60% in the last 21 months. We've completed over 1.3 million claims for veterans in 2014. That's 150,000 more than last year. We guaranteed 2 million home loans with the lowest foreclosure rate and the highest satisfaction rate in mortgage lending. That may seem counterintuitive, but veterans don't get foreclosed on their mortgages. For the past decade, the American Customer Satisfaction Index has rated our cemetery system the top customer service organization in the nation, public or private. And since 2004, the same index has also shown that veterans give VA healthcare higher ratings than patients at most private hospitals. With the right strategies and support, there's no reason why we can't return the entire Veterans Affairs Department to this kind of excellence all across the department. Let's talk about our healthcare clients. We think we have the very best clients in the world. About 9 million veterans are enrolled in VA healthcare. That's of a total of about 23 million veterans in the country. We have everything from the 90-year-old World War II veteran to the 20-year-old veteran of Iraq and Afghanistan. I don't know of any other business that has better clients than we do, and I'd like to introduce them to you now.
My dad's a doctor, and he takes care of heroes every day. It takes a special person to do what he does. Every day he sees people with different hurts and scars. Small ones, big ones, complicated ones that never go away, and others that are invisible to everybody else. The scars aren't just on the outside. Sometimes, my dad says, people hurt more on the inside, and you can't see those scars. Those scars take a long time to heal. Where my dad works, they make sure to know lots about the veterans they treat. Like where they were hurt, what doctors have tried to help before, the medicines they have to take, and other important stuff so that they can be taken care of at other VA hospitals like his. My dad always says every veteran should be able to live a happy, healthy life. as they risk their lives to protect and serve the United States of America. My dad's a hero to a lot of people, but mostly he's my hero. This is my dad.
Thank you, honey. Hey, kids. So who wants to be a doctor? Yeah, you. Tell us why.
Those are our clients, they're heroes, and we believe at the VA that our people who serve those heroes are also heroes. In terms of our facilities, we have, well, I guess we should say 151 medical centers. I think you've seen our new one here. It's open for business. We've got 819 community-based outpatient clinics. These community-based outpatient clinics are networked with the larger medical centers. We have 300 vet centers. Think of these as readjustment centers, particularly for veterans returning from battlefields for mental health issues. 104 residential rehabilitation treatment programs, and we have outreach and mobile facilities, and I would argue we're one of the leaders in the country, maybe in the world, on telehealth and telemental health in particular. Here at Lake Nona, we've got this beautiful new facility. In 2012, when we opened a new medical center in Las Vegas, it was our first brand new medical center in 17 years. Fortunately, particularly after fighting wars for the last 13 years, it's good that we have this facility here. Part of the reason that we've shifted a little bit in priority and we're building fewer of these large medical centers and we're building more of the community-based outpatient centers. In fact, we're generally leasing many of them rather than building them so that they aren't capital appropriations. But our infrastructure is a real issue. I testified yesterday morning in front of the Senate Veterans Affairs Committee about our 2016 budget. And one of the things I told them is no company in the world would have an infrastructure like we have. Our buildings are very old, and because they're so old, we have huge issues. I was in Boston recently, and I was discovering that one of the limitations to our surgery in our operating rooms is the size of our operating rooms. You know, the operating rooms we need today are much, much larger than they were in the past because of the robotics, the broadband, the computers that we need to do the operations. Get this, 900 of our VA facilities are over 90 years old. More than 1,300 are over 70 years old. And we currently have 336 buildings that are vacant or less than 50% occupied. And I told the members of Congress yesterday that we've got over 10 million square feet of unusable space that costs the American taxpayer $24 million a year, and we can't get the members of Congress to allow us to close those facilities. So we're working hard to do that. It's the right thing to do, and we're going to do it. VA healthcare is a three-legged stool. One of the things I discovered two things. When I was going around during my Senate confirmation hearings, there were some members of Congress who said to me, well, why don't you just come in here, close the VA down, we'll give everybody vouchers, and we don't need this bureaucracy. And what I discovered was two things. Number one, the VA is critical to American medicine. And number two, the VA is the canary in the coal mine for American medicine. We see things in American medicine that American medicine doesn't see till later. So we can play a role with the American public in educating them about the needs. An example is primary care physicians. Last time I was here, I was recruiting at the University of Central Florida Medical School to try to get more primary care physicians. By the way, any of you are primary care physicians or physicians at all, we are hiring and I would love to talk to you. And in that meeting I discovered that the figure I was given was Florida needed 17,000 primary care physicians. I was out in California at a medical conference in San Diego, at UC San Diego, and Janet Napolitano, the president of University Systems, said California needed 22,000 family care physicians. Yesterday I was getting grilled about our lack of primary care physicians in rural areas, in Kansas by Senator Moran, in Montana by Senator Tester. And then I think it was Senator Sanders said, yeah, but Jerry, I heard that you had a hospital in Kansas in a rural area that has no doctors at all. So this is a real issue for our country, and one that I'm working hard to try to solve. But what I like about the VA system and what we like about our doctors who serve in it is we're a three-legged stool: research, education, and the clinical work. And our veterans get to benefit from that three-legged stool. What do I mean by research? Well, I don't know if you knew this, but doctors at VA have won 3 Nobel Prizes and 7 Lasker Awards. We've done groundbreaking research in post-traumatic stress and in traumatic brain injury. We developed the first implantable cardiac pacemaker. We developed the shingles vaccine. We developed the nicotine patch. We are the first ones to create artificial limbs that can operate by signals from the brain. We identified the genetic risk factors for schizophrenia, Alzheimer's, and Werner's syndrome. Our nurse was, one of our nurses was the first to put barcodes on medical records, patient things, and drugs to keep them all straight. And of course, the electronic medical record, which we're still pioneering and working hard to improve. At the same time, education is also a critical part of what we do. Did you realize that over 70% of the doctors in this country are trained at the VA? It's a critical part of what we do. The other day at a House committee hearing on our 2016 budget, I was asked by one of the doctors on the committee, why are your productivity rates for the number of minutes your doctors spend with patients not as high as they are in the private sector? And I said a couple of reasons. Number one, our patients have generally more symptoms or more illnesses than the average patient because of their age and because of what they've been through in combat and other things. But number two, our doctors are teaching at the same time, and that's an important thing that we do for American medicine. So we love to partner with medical schools, and some of our very best medical centers are partnered with medical schools, just like we are here with the University of Central Florida Medical School. In Palo Alto, we're partnered with Stanford Medical School. In Boston, with Harvard, with Boston University. In San Francisco, with UC San Francisco. So this is a very important thing that we do. The other thing we do is we partner with law schools. That was why I was at Harvard Law School not too long ago. And we work together at these law schools to help create something called veterans courts. Veterans courts are a way that we can make sure that veterans get the proper jurisprudence rather than immediately getting slammed into jail. We're working hard to reduce veteran homelessness. We've driven down veterans homelessness by 33%, and we've committed to end veterans homelessness by the end of this calendar year. But to do that, we've got to stop the unnecessary incarceration of veterans. Incarceration is one of the things that leads to the homelessness of veterans, and so we're working hard to do that. I'm a big believer in this because I'm a big believer in Stephen Covey's 7 Habits of Highly Effective People. I don't know if you've read that book, but in there, Stephen Covey says, if you want to learn something, teach it. So I love when our doctors teach because it makes them even better doctors doing our clinical work. And the third leg of our stool is our clinical work, 240,000 episodes of care every single day, more than 90 million scheduled appointments in 2013 alone, and of course that number is going up. We have about 340,000 employees working hard to care for our veterans. We have great people, but we need even more. So if you're interested in a high calling, competitive pay, let me know. We'd love to talk about it. Excellence today. We're a national leader in reducing MRSA infections. We've been called out on that. We're proud of that. We've won the J.B. Barnwell Award Dr. Michael Osmond won that for his leadership in creating the shingles vaccination. And these are some of the other awards that we've won. It's really been my privilege to be involved in some of these awards, and I'd like to tell you about one. It's a story of a Dr. Bill Bauman and a Dr. Ann Spungen, who both work at our Bronx medical care facility. Bronx is one of our outstanding innovation hubs. We've had Nobel Prize-winning doctors work there. And Bill, his family, his father worked at the Bronx VA as well, but Bill and Ann have dedicated their lives to working on spinal cord injuries. Not just what do you do about the spinal cord injury, but how the spinal cord injury affects all of the other systems of the body. Groundbreaking work. And because of that groundbreaking work, I was able to give them 2 of the Sammy Awards this year. This year there were 8 Sammy Awards given. Sammy Awards are given to outstanding federal employees who do the most for the American public. And I was able to give 2 of the 8 to Ann and Bill. Please watch this video.
I grew up in a family of 2 physicians, and my father had the incredible opportunity to work here at this institution. From my earliest days, my father would tell me how great the research was at the Bronx VA. One of the primary missions is to provide the highest quality biomedical investigation to improve the health and well-being of veterans, and by doing so, all Americans.
I share the responsibility with Dr. Bauman to help the center find the best way to improve the medical care, health care, and quality of life of people living with spinal cord injury.
The work that we do in our unit is to identify what goes wrong with the body after spinal cord injury, and essentially everything goes wrong.
When someone gets a spinal cord injury, the first thing they're concerned with is they can't walk. But as the years go by, they learn that that's really the least of their problems.
You lose muscle quickly, you gain fat also fairly quickly. When that occurs, it may lead to abnormalities in metabolism. There are no reduced stresses and strains on bone. That reduction in forces on the bones causes severe osteoporosis and may lead to fractures. And pressure ulcers are a terrible problem.
Finding the cure is great, but right now there's a lot of medical problems that have to be addressed in this population to help them have better quality of life. In 2010, there was Dr. Amit Gopher is an engineer out of Israel. He's actually a person with tetraplegia himself, and he had contacted Dr. Bauman to say he has this new exoskeleton called the Rewalk that he wanted to come and show us. And I was completely skeptical. The person that the company brought to walk in the device, I was told was a paraplegic. But I just see this person walking into the ward downstairs to the community day room in this device. I'm told he's a paraplegic, and I'm convinced it's a hoax. But, you know, he walked up and down the halls, and I turned to Dr. Bauman and I said, we're doing this. We have to find out if this is going to help the veterans with spinal cord injury.
The technology for the robotic exoskeleton is game-changing. It is something that permits an individual who has been seated in a wheelchair to stand and to walk. And if you have been injured and you have been unable to stand eye to eye with your fellow human beings, and you can stand up, and then you can miraculously appear to walk, it is an incredibly uplifting experience. We have observed that being up in an exoskeleton makes the gut work again, which is truly remarkable.
And until there's a cure for spinal cord injury, this is probably their biggest hope for being able to walk over ground, for potentially walking down a sidewalk or in a mall, or going to a park with their children even.
There is something special about being afforded the opportunity to broadly assist others. I was taught that if I could contribute to improve the lives of others, provide innovative care, and reduce suffering, then it is a privilege to do so. Federal service allows you to do so in a grand manner.
So we use these exoskeletons in our therapy and actually get spinal cord injured individuals up every day for therapy so that their other systems will work better. And we haven't proven this yet, but we actually believe we will be able to lengthen the life of spinal cord injured people. The lifespan of spinal cord injured people on average is reduced because of that immobility. In addition to the exoskeleton, we also have a rewalk system that is more portable, that can actually be taken home, so the individual can actually walk at home, which is tremendous therapy again. These are some of the things that we do as part of our innovation. We have a Million Vet project in Boston, where we have the blood of 1 million veterans, where we're mapping the genome of those 1 million veterans. That's available for anyone who wants to do research on this set of veterans. We also have a brain bank in Boston, in the Bronx, where we have a certain number of brains. So we're really open for business. We want to do innovation, and we'd love to partner with any of you. And we'd love to look long term, how can we make Lake Nona a site for VA on a national basis of doing some of these innovative things? Because innovation is the way we better care for our veterans, and it's also the way that we help American medicine. Now, certainly in 2014, we had problems in the VA. We had a crisis that had Phoenix as its epicenter, but we look at that crisis as a huge opportunity to move forward and regain excellence. What we've been working hard on is increasing access to care. We've gotten the wait times down around the country to about 18% down. We're down to, on average, about 30 days across our system. In many places, it's 0. And in many specialties, it's basically on a walk-in basis. We're making progress on mental health. We've got mental health people around our emergency rooms. We're also making progress on military sexual trauma, where we have experts in every region of our country. So we're making progress, but we've got more to be made, and that's what we'll be working hard to do. In order to do that, we need two things, really. One, we need more buildings, and we need more buildings that are current, that have the capability of helping us. One of the problems in Phoenix wasn't just the staffing. Staffing was a problem as I dug into it, but the other problem was we had only 1 clinical room for every primary care provider, rather than the normal at least 3 clinical rooms that they would have. So we're in the process of expanding the building. But one of the other issues we have is we need people. And so I've been out talking. I've been to about 12 medical schools now, recruiting new doctors and nurses. Congress has helped me. In the Choice Act that was passed last fall, we were able to double the loan payback that we can do. So we can go, rather than just paying back $60,000 of somebody's medical school loans, we can pay back $120,000. So any of you that are currently paying off your loans, come see me, and in exchange for some work at the VA, we can pay off your loans, and we'd love to have you. We also took a look at the salary ranges for VA doctors and nurses, and we've made them competitive, or more competitive, with the private sector. At the same time, we're working toward a long-term reorganization of the VA. We call it My VA. We're calling it My VA because we want every veteran to think of this organization as their own. We want them to think about the VA the same way you would think about your favorite brand, that you would have an intimate relationship with that brand, or how you might think of your smartphone that you've customized to your needs. So the first thing we're trying to do is improve the veteran experience. I've asked for some help from some of my colleagues formerly in the private sector. Fred Lee, who lives close by here, wrote a book called If Disney Ran Your Hospital. Bob Iger at Disney is helping us as well. We want every veteran to have a Disney-like experience when they come into our facilities. We're also working to improve the employee experience, focusing on our employees and our people, our culture, their ability to learn and develop, because we know we have no hope of taking care of veterans well if we don't take care of the employees who do that. Third, we're looking at creating internal support services. Right now, we have vertical silos in our organization where we have redundant services across the department. We're going to create those services pan-enterprise, and any productivity we get, we're going to reapply that headcount and that money where the veterans need it. Number 4, we're establishing a culture of continual improvement. Carolyn Clancy, our interim Undersecretary for Health, said to me, if you've seen one VA medical center, you've seen one VA medical center. And she's right. All 151 operate differently. We don't yet have established best practices that we have brought out across the entire system. And number 5, enhancing strategic partnerships. Strategic partnerships for us are a force multiplier. That's why I wanted to come here today. That's why I was communicating with Alex Gorski, my friend who runs Johnson & Johnson. That's why we're working on strategic partnerships with a lot of organizations all over the country. We know we can't do this job ourselves. We need help, and strategic partnerships are a big part of that. Really, my VA is about putting veterans first and putting veterans at the center of everything we do. What happens in a government bureaucracy oftentimes is it becomes very inward-looking, particularly when a crisis occurs. It's normal human psychology to look inward. What we're trying to do is get everybody to face out, go out, help veterans, and really put the veterans at the center of everything we do. The other thing we're trying to do is empower our employees. As I've gone around, I've been to about over 100 different sites of VA operations. Employees tell me they feel like they're prisoners of a system they can't control. And what I'm doing is I'm going around and I'm saying, no, you are in control. We're setting up teams of lower level of employees all over the country. Those teams are working together to tell us how to improve VA. The My VA change is going to be a change led by employees, not by the management only, top down. 3, we're working to improve the processes that impede good customer service. And believe me, there are lots of them. And we're trying to knock them out one by one. And we're trying to just change the way we think about our internal structures and processes so we can better serve veterans. One of the quick things we did is we reorganized the department geographically. When I got to the department, as I said earlier, we have 9 different lines of business. Well, each one of those 9 lines of business had its own geographic map and its own organizational structure. So we had 9 different lines of business, 9 different geographic maps, 9 organizations, structures. You can imagine the veteran trying to navigate between VA and the different benefits and healthcare, cemetery benefits. It was mind-boggling in complexity. 14 different websites with the required different usernames and passwords. I don't know about you, but I hate carrying around with me a sheet that has all the different usernames and passwords, and I hate those of you who have websites that say you can't use that password on my website, you need a colon or an apostrophe or something, you know, so I have to create another password. So we've gone to one geographic map with only 5 regions, and we're going to be moving the entire organization to this structure, working to minimize spans and layers as we move our way there. In terms of strategic partnerships, just let me say that if you saw the World Series, Major League Baseball has been a great strategic partner of the VA, but we've not taken advantage of it. And so we're in the process of working with Major League Baseball to see what we can do together. I went to Boston, where there's an organization called Home Base that's funded by the Boston Red Sox. It's a great operation. They deal with the traumatic brain injury, post-traumatic stress of veterans. And in the past, I was told that the VA had seen them as competition and didn't want to participate. In contrast, we are embracing them. In fact, I've hired somebody from the private sector who's going to help us with strategic partnerships. His name's Matt Collier. And one of the things we're going to do is we're going to embrace these people as force multipliers. One of the reasons, one of the very easy reasons why, is 15% of our veterans today have less than honorable discharges. And by law, the VA cannot care for people with less than honorable discharges. But that was the process back during the Vietnam War to get people out of the military, was to give them a less than honorable discharge. DOD is going back now, Department of Defense is going back, trying to identify those people and change their discharge status so we can care for them. where it's appropriate. But in the meantime, Major League Baseball and home base are stepping up, and they can care for those people that we can't care for. It seems very simple, and it's very simple when you look at it through the lens of a veteran. What's right for the veteran, and let's certainly do that. That concludes my, my formal remarks. That's a little bit about VA, about the importance of VA to American medicine, about the canary in the coal mine role that we play, and I'd be happy to take any questions that you may have at this time. Will you tell me when the time is up? Or? Okay. Okay. Happy to take any questions or comments that you might have. If you don't mind, please start with your first name. My name is Bob.
My name is Robert.
Hi, Robert. I like your name.
Thanks.
That's my son's name.
Very inspiring talk and definitely a lot going on. Earlier today, we heard about how in the state of Maryland, the focus on better management of chronic conditions has freed up hospital space. So when you think about strategic partnerships, does it also extend over to the private acute care area, since you need more of that type of space?
Absolutely. We have no pride. We want to partner with everybody. In fact, today's Friday, Wednesday, I had a meeting with the leadership of Virginia and Governor Terry McAuliffe, and their Veterans Affairs people as well as their health people. And that was exactly the issue we talked about, was how can we get space for VA in some of their remote area hospitals. And so we're open for business. We want to work with every governor. We want to work with every mayor. I give you an example too, and particularly this is a mayoral issue. We have committed to end homelessness by the end of this, of veterans, by the end of this calendar year, and then that will teach us how to end homelessness for all Americans. But in order to do that, we need partnerships. To end homelessness, we can have the HUD-VASH vouchers that pay for the home, that pay for the residents, but we need the local landlords who are willing to rent for that amount of money to those veterans to get in. So we work with mayors to do that, and we ask them to commit to end homelessness by the end of this year. In New Orleans, Mitch, who's the mayor there, made a commitment, and 6 months later we had ended homelessness. A few months ago, I went out to Los Angeles. VA had been sued for 4 years by the community in Los Angeles because we had 380 acres that was given to us in the 1880s, yet we had a high homeless population, and we weren't providing for those homeless veterans on that property. We solved that lawsuit, and we're moving forward to get those veterans in the home. So strategic partnerships is absolutely critical to what we do, and we take no pride. We want to partner with everyone. Thank you for the question. Other questions, comments? I'm sorry, I can't see because I have the lights in my eyes, but.
Yeah, hi, sir. Good morning. Lieutenant Colonel Daniel Johnston. I'm an Army physician.
Thank you for your service.
Thank you, sir. A question, two quick questions.
And if you'd like to leave, you're in DOD now, if you'd like to come to VA, we've got great.
I think I better finish the DOD first, and then maybe we can talk. So I got a couple more years. Just a question as far as the kind of command and control sort of structure of the VA in terms of actually being able to have strong accountability with the various hospitals throughout the country, somewhat like the DOD does have due to its leadership structure. Have you, coming into this job, found that as somewhat of a challenge, and do you have a plan for that? And then my second question is on interoperability between the DOD health records and when somebody transitions over to the VA, having a seamless EHR system. Where is that in your priority, and do you have a plan of attack for that? Thank you, sir.
Good, both good questions. First, I've been amazed at the lack of connectiveness in the VA. As I said, if you go to one medical center, you've only seen one medical center. They are not well connected. For whatever reason, the leadership has not well connected them one from the other. And I'm used to running a global business. We were in every country of the world, and we would identify a best practice, and then everybody would work to innovate beyond the best practice, but in the meantime, that best practice goes to every operation in the world. We do not have that today. That's what Dr. Carolyn Clancy is trying to put in place, but we're not there yet, so we don't have that. I'll give you an example. I went to our HR leader, and I said, I'd like to have a list of the top development 50 individuals in our hospital system. And she couldn't produce it because the HR leaders in the hospital system do not report up in a functional way to the HR leader of VA. That is not the way to run a successful organization. It's too disconnected, it's too decentralized, and in today's world with digital communication capability, that's a prescription for disaster. So we're going to fix that. The second question about the interoperability of health record, this is a very high priority for us. There's no reason the veterans should be punished because the government has divided DOD from VA. There's no reason the veterans should be punished because VA has a benefits arm, a health arm, and a cemeteries arm. They should be seamless. They should be integrated. And to do that, what we've had to do is work against a common medical record. Now, initially, the thought was that we would create an identical record between DOD and VA. But the DOD doctors and the VA doctors got together and said, that's really not possible. It can't be identical because the needs of each organization are different. Our needs are all about the clinical work. The needs in DOD are oftentimes about identifying causality. So what the group has moved to, and this was before my time, is interoperability, meaning it's all ones and zeros. So how do you make sure it's interoperable so the DOD doctors and the VA doctors can see the record of DOD and so forth? That's been done, but we still have more work to do because we want to improve our record even more. It's my belief, our record is open source, so you're welcome to use our record. It's called Vista, it's free, and we can help you get it installed. You're welcome to use it because this issue of interoperability becomes not only important now with DOD and VA, but it's also going to be important for those doctors in the private sector who are willing to take veteran patients through the choice program or through our pre-existing program, which was called PC3. So we're working very hard on that. Open source and crowdsourced innovation. If you use our record, we'd love to hear from you as to how we can improve it, because then we'll make those improvements and make them system-wide at no cost. So that's a very, very important thing that we do, not just for our veterans, but also for the veterans who go into the private sector. Other questions, comments? Yes, yes, ma'am.
I'm Deb German.
Hi, Deb.
I'm your College of Medicine dean right here.
Thank you.
No, thank you. And
I loved speaking to your students.
thank you.
It was very inspiring.
Well, this is more a comment, and you know, you're solving a lot of problems, and I guess I just want you to know what a wonderful job your team here in Orlando is doing, and I see
Tim is here. I know. I saw him
I see
earlier.
Mr. Tim Lazert and
Yep.
Dr. Ken Goldberg there, and I just want to. And I'm thanking you from two perspectives. One, I get to work with them, and it's the best job in the world. But two, my dad is a World War II veteran. He lives here, and he goes to their clinic, and the clinic is moving. It just moved. And every step of the way, he comes home and tells me about the amazing things they're doing. And it makes our practice better to see what your practice is doing. So thank you for myself and for my dad.
Thank you. We want to continue to work with you. We want to make sure we get more residences and get those residencies in the right location. I know that's good for you too, but that's important. All of us care so much about veterans. I know the media has been, the media has been talking about all the bad things, but there are a lot of good things. And I would argue that the majority of employees are doing the right thing every single day. And I lose patience when people want to politicize care for veterans because it's not politics. We're here to care for veterans. I was retired. I'm not running for office. I'm not doing anything but doing one thing, trying to care for veterans. My father-in-law was a tail gunner on a B-25, shot down over Germany, POW, post-traumatic stress, clearly. I wished I had known what I know today 25 years ago. My uncle-in-law, Agent Orange, 101st Airborne Vietnam, all kinds of catastrophes, Agent Orange brings. You know, this is very personal. And I know it's personal for you, it's personal for me, but that's what makes our job so fulfilling. you may know this, I gave out my cell phone number nationally, and the Washington Post and other people have been kind to me by continuing to publish it. And so I get hundreds of calls every single day and texts about what's going on. Initially, they were all really negative, and we stood up a team of people to try to solve some of these problems. But these problems, we're starting to get to solve them. It doesn't mean everybody gets 100% disability, but you know, we're trying to solve them fair. Taxpayer, we have to be good stewards of taxpayer money. And when you get those notes back, and I got one last night, you changed my life. I have 4 children. I got a picture of the 4 children. We now have a home we can live in. All you have to do is solve one, and one's really fulfilling. Thank you. Thank you, Deb, for what you do. Done? Done? Am I done? Yeah. I'm sorry. I'm done. Thank you very much. Thank you, Pat. It's great to be with you.